Marvin, what's the extent of mental health issues in our community, and what are the challenges that they pose for those affected, their families and the communities? If you could start off.
Yeah, so I think increasingly over the last few years, people have become more tuned into the idea that mental health isn't just a strange area, an embarrassing area of life that we tack onto real health issues, but it's actually the permanent backdrop, the permanent foundation to our families and our communities and our societies. The numbers go around 1 in 4 people in their lifetimes, we all know these, will experience a mental health condition at some time in their life. 1 in 10 of our children being unhappy. The cost to the national economy, £104 billion a year. That's mental health services. When you add up the economic costs of absenteeism and lost productivity, this is a huge part of what we are. So I think in many ways the discussion around is mental health important to us at community level or societal level is been won. I think the challenge is beginning to reorient our services and our way of life to act as though actually that's actually very serious. But I think my reflection on this question is it's not just about the permanent backdrop of mental health against all society, because that sounds like it lands evenly across all people when it doesn't. So when we talk about the impact on our community, if we're thinking about Bristol, my question is, well, which community? Which Bristol? Because different people in different parts of this city experience mental health differently, and they experience the consequences of having poor mental health differently. So we know that in poor areas, though what we call the social determinants of health, stress, unemployment, absence of a living wage, poverty, deprivation, or the presence of inequality, all these things impact on some people and add extra stresses to their lives in levels that many people, and I imagine some people in the room, just couldn't imagine. And it's that permanent backdrop is the thing that really pains me. And I think too, when we think about, well, what happens when people do have a mental health condition? Well, some people will get access to early interventions. Other people will enter the system through the criminal justice system. They'll end up with treatment because they've been arrested, detained, or they would have gone to prison before they've even been diagnosed. So what we have is the dangers of a health condition and problematic access to mental health services playing themselves out in the lives of certain communities, black communities, poor communities. They become a criminal justice issue. They become a family breakdown issue. And then that comes to represent, that becomes a problem because it just compounds that sense of alienation and marginalization from our big institutions that we all pay for, that are supposed to serve us equally, but unfortunately, they don't. So I think one is about talking about winning that argument, as I think we have, that this is the permanent backdrop. The other is about getting a little bit real, that different people experience mental health incredibly differently in our culture today.
Okay, thank you. Are there any other comments? Have you got any comments on that particular question?
I think I'd like to add, I mean, in terms of global burden of disease, depression is number one and drug and alcohol dependence is number two. As a doctor, I know that prevention is better than cure, and prevention means that we must work together in a multi-system approach. There is enormous risk with mental health at the moment. Although mental health provides the two biggest burden of diseases globally, the funding for mental health is reduced in comparison to mental health. And furthermore, the drug and alcohol budget, there's a great threat on that because that's been split off from health funding and into local authority funding, which is much easier to cut in terms of a political agenda nationally. So I think there is an enormous threat. We must work together in partnership and as a whole system to try and prevent these things happening, but there's an enormous tide that we're having to work against to do that.
Okay. Can I just, did you want to respond to that?
Yeah, I was just going to pick up on that point. I think, broadly speaking, we speak in terms of around 22% of the health burden being related to mental health. That is in no way reflected in the spend on mental health. But I welcome the points that Marvin was making, which is about expanding out our understanding of the determinants of good mental health. This isn't all about having specialist services delivering individual interventions. Sorry. Marvin's Twitter account going wild there. It's about providing a broader network of resilience. So I think it's helpful if we're going to have a fairly progressive conversation about mental health provision that we're thinking outside of nurses, doctors, hospitals. This is about how we as a society organise ourselves, how we relate to one another, how we really draw out the riches of what is already going on, and aligning that in a helpful way.